Dr. Garrett, lots of people look at their mouth and their teeth and their smile as something they want to beautify. They want to make nicer and better. And some people really need it, some not so much. Whatever it is, people want to look a certain way. Or people sometimes, don't realize that their smile it handicaps them in career, in just about everything, and that it actually could be relatively easy fixed with a dentist. Shade a little bit of light on what cosmetic dentistry these days can do, what tools are available, and that type of things, and the difference it could potentially make.
Well, there's many different things. First of all, the first thing is cleanings. Cleanings are going to remove a lot of the different stains, a lot of the imperfections that people start seeing on their teeth just by polishing the teeth and removing all those negative effects. Then you have things like whitenings that will help reduce or increase the shade of a tooth. 1, 2, 3 shades, so it makes them look lighter and whiter. It really depends upon the starting point. And then we have other things like having straight teeth. For example, some people have, as adults, their teeth start bunching up, they start crowding, those teeth start cracking, they start, how shall we say, I wouldn't say call it getting dirtier, but they're getting more stained because it's a little bit more difficult to clean. So nowadays there's things like Clear Correct, Invisalign, which are clear liners. There's obviously conventional braces that can get the teeth in a better position. And if their teeth are in a better position, then they reflect the light better and they look much nicer. Beyond that, there's also cosmetic bonding, which can remove or fix certain small imperfections in selective cases. Aside from that, I would say good diet and good regular hygiene are the staple plate of this.
Well, all right. And you in your office, are you engaging in looking at people's face and say, look, especially if they want to, we can shorten, lengthen your teeth, we can make them wider, we can make them this and that, we can straighten them out, and are you basically, is cosmetic dentistry a big part of your practice?
I would say that each person is different. The most important factors, I always tell people that if they have a clean mouth, that they deserve beautiful teeth. That's kind of my motto. I always tell people, it's like, listen, you have very good hygiene. Would you like your teeth to be whiter? Would you like your teeth to, reflect, how much you're taking care of yourself? A lot of people end up kind of accepting the appearance of their teeth in general terms as they get older. I have patients that walk in through the door that, for example, say, I'm not smiling anymore. I go in the pictures and like this. I want to be able to smile again. And those are things that each person can have. I mean, I really amazing, because I tell people, listen, you can use braces into your 70s, into your 80s. Now there's not an age limitation. You can have whiter teeth. In other words, we don't have to age and have our teeth look old. We can have very nice young looking teeth throughout our whole life. And veneers, cosmetic bonding, regular cleanings, whitenings, orthodontic treatments, implants in the front area to replace lost teeth. All those are things that can make the teeth look really nice and natural.
So basically, the tools are out there; they are available, and it does make a big impact, because that smile, that face, that's what it is all. That's why they call it the $1 million smile of like Julia Robertson or Tom Cruise or whatever it might be, right?
Yeah, exactly. As an example, people, we gravitate towards a movie, and there's all these close-ups. People don't realize how much people are our first impression is really starts in our eyes and starts in our smile. And if we, if we're not smiling,
right. And some of the things you mentioned here, it doesn't look like they necessarily cost $1 million to get the $1 million smile. I mean, sometimes, yes, it can go a little bit into more money, but often it's probably a very small correction here and there, which really it doesn't break the bank, so to say.
The way things are set up nowadays with with different finances, payment plans, insurance, all these different things combined, pretty much dentistry nowadays is very accessible to everybody. If it's really something that you want, there's a way to help you get it in a very accessible way for every single person. Does that mean it will be done in a short period of time? It really depends on the situation. But some people, if it's something that they really wanted, it can be done over a longer period of time, but it's accessible for every single person out there.
Wonderful, Dr. Garate. Thank you very much.